So LASIK is a very advanced procedure. It's a procedure that is very safe and very effective. It's most effective in somebody with a healthy eye, somebody who doesn't have any sort of pathology, any disease. It's a great option for people with refractive stability. So you come in year after year after year to get your eyes checked and your prescription's constantly changing. That individual may not be a really good candidate for LASIK because it's a moving target, and that's tough to hit.
Really what we're looking for is a stable refraction, an individual who has reached a point in their life where their glasses are the same and they don't change. So, many people who wear glasses, they went through this process where every year they get a new pair because their prescription was changing each year.
When is the time to come in, and how do you know if you're a good candidate? Well, it's not only your glasses prescription, it's not only that little number on your contact lens box that drives your candidacy for LASIK. There's a number of other variables. The thickness of your cornea, for instance, the health of your retina. So the best thing I can tell a prospective patient is just come on in. We'll take a look. We'll give you our honest opinion. There's no sales push. It's when you say yes or no. And again, if LASIK's not a good option for you, there's something else that is. And we are proud to offer the widest range of refraction options in the state.
We see patients commonly who come in and say, well, my LASIK wore off. And they'll say, well, I had LASIK in 1995, and I'm wearing glasses now for the last couple of years. Well, the LASIK didn't wear off. What happened is, time marches on, and you can develop cataracts, and that is the sort of thing that is ubiquitous. If you collect enough birthdays, you're going to develop cataracts. That is just life. And that will influence the refraction. That will cause the prescription to change. And now we have a great solution for that as well. If you're looking to get rid of those glasses that you enjoyed so many years not needing, we can do a cataract surgery that is incredibly accurate now. The technology that we have available can provide tack-sharp vision, and that's called refractive cataract surgery. One of the greatest developments in my career has been the introduction of a light adjustable implant for cataract surgery. This is an implant that we can change the shape of. Think of it like doing a refraction inside. Once that is implanted, we can use UV light to take the refraction that is residual, whatever is there, and instead of making glasses from those numbers, we program a deformable mirror and we shine UV light onto the implant, and essentially we're perfecting the vision. It is a game changer, and this is something where we can achieve tack-sharp quality vision in virtually everyone.
That almost sounds too good to be true, right?
Well, it does sound too good, but it works. I mean, this is the sort of thing where we have the technology to make a good lens. I mean, that's the optics of that have been around for a long time. And now the ability to take this material that is deformable, this material that has the ability to change its shape, and use that to correct the vision. This is just the natural evolution of the technology.
Yeah, and it lasts as long as you do. This is not a procedure that has to be redone in 10 years. Maybe like a knee replacement or a hip replacement, you may have to have that done in about a decade or so. This is yours until you're no longer around. It's going into the ground with you.
It doesn't wear out is a good way to think of it. Patients will say, well, wait a second, my glasses, they've changed every 2-3 years. I've been told I have cataracts, and they're trying to keep up with it. Will this implant still work for me 5 years from now? And the answer is yes. The reason the prescription may have been changing or was changing is because that's what happens with the cataract. Once the cataract is gone, this implant, it doesn't wear out, it doesn't stop working. It's like a high quality, clear piece of glass where it doesn't wear out. A window doesn't wear out.